the dream for any entrepreneur. As we see in the US, the data there is standardized and is accessible by companies, for companies, innovative companies. So if we can have across member states standardized data, that the member states would agree on the format of the data, collect data in similar fashion, and also we can even make much more innovators, and we can jump the innovation curve, because instead of collecting data, healthcare data as a legacy, we won't have a legacy here. We're going to collect data to train machines and get our healthcare system ready for the fourth industrial revolution. So at the moment, the data that is available in healthcare is not collected to train AI. It's collected for transactional purposes, like claims data, or for workflow purposes. Now we have the opportunity to be the first in collecting data to train artificial intelligence system. And what matters there is three things. First, we need to agree on the key variables that we need to collect, because not everything matters for a machine. It's not a transaction that is not important for health outcomes. So how we can, between insurers, between healthcare providers, how we can collect data in a fashion to create a strong AI prediction systems for our healthcare system. So that's number one. Number two is access. At the moment, even in mature countries like the UK, where we have some of the healthcare data, the access is provided in a research fashion. You have to define a study protocol, you have to set your inclusion-exclusion criteria, and it doesn't really take into account the self-learning machines that the AI learns and refreshes automatically from the data. So we don't need study protocols. What we need is API, access to this data as companies. And also, when I'm part of discussions about the European health data space, I only hear about given access to research organizations, to academic institutions. I don't hear about getting access to innovative companies to create the unicorns in healthcare in Europe. So that's number two. And last but not least, the outcomes. It matters. We are moving from a volume-based economy to an outcome-based economy. It's not about, we don't want our healthcare economy to be about how much pills we sell. It's about whether those pills worked. And that's why defining the outcomes is crucial. At the moment, if you look to data from claims, for example, when a patient disappears from the claims data, it disappears because maybe he switched provider, or because he died, we don't know. So we need to really define for every disease area the key outcomes, and we need to track those.